Welcome to TechNation's On-Demand webinar series. This is a new series of on-demand webinars focused specifically on the biomedical and HTM industry. New webinars will be added on a regular basis, and each will be eligible for 1 CE credit from the ACI. At the conclusion of this presentation, you will be able to access a link that will take you to a quick survey. You will be able to download your certificate once you submit the survey. Today's presentation is titled Breaking Barriers, Promoting Patient Safety Through a Comprehensive Database of Preventative Maintenance, and will be presented by Travis Horstman, Biomedical Advisor at oneSOURCE document site.
Thank you for that introduction. My name is Travis Horstman, and today, as stated, we're going to be talking about breaking barriers, promoting patient safety through a comprehensive database of preventative maintenance. A little bit about myself. I'm a former United States Air Force AMI certified biomedical equipment technician. Got 7 years experience in 3 different medical facilities as a biomed, and the last 2 years of my career I was managing a clinical engineering department. I've been at oneSOURCE for about 5 years, researching and developing, kind of addressing the needs of clinical engineering departments. I've also still in the United States Air Force Reserve as a cybersecurity specialist, and I currently hold a CompTIA Security Plus certification. So the objectives of this webinar today are to explain the impact of clinical engineering departments have on patient safety, evaluate streamlining preventative maintenance through the reducing variation in medical treatment facility maintenance activities, exploring new technologies and products, and access to proper maintenance materials. And then we're going to talk about the importance of oneSOURCE can be to clinical engineering departments. And then I'm going to do a short product demo, and we'll go through some questions if there is any. So the first role is patient safety, and patient safety is kind of overlooked as far when it comes to clinical engineering. We don't work directly with the patients, so we're not as seen as someone that directly impacts it. But clinical engineering is a hub for all equipment-related issues and questions. So anybody on the floor that's working on a patient that has questions about the operation or or if something's breaking, they're going to contact the biomeds, and they need to provide accurate information to everybody to make sure that they're using the equipment properly. And if they give incorrect information or don't provide timely response, that can be catastrophic to patient safety. And also, new networked equipment devices pose new risks that BMETs must manage. These newer network devices, they have less security than normal, like your computer. So it's more at risk for attackers to infiltrate, and certain precautions need to be taken by the BMETs. Because if they are infiltrated or hacked in a sense, they can alter patients' dosage or kind of results that are being fed to a telemetry monitor that can really impact patient's health and safety. And also, tracking and performing corrective action regarding critical device alerts are managed by the clinical engineering department. So if there is a device that there was some manufacturer defect, it's the clinical engineer's responsibility to take that out of service and make the corrective action if necessary. So if without the clinical engineers doing this, it can lead to preventable patient catastrophes or patient harm. So that's another way that BMETs directly assist in patient safety or provide that patient safety mark. And of course, they always verify the safe and correct operation of medical devices. If it's been maintained, if it has that sticker that says it's been maintained, the staff and the operators know that that medical device is good to go. So if a BMET doesn't correct it properly and there's a reading off in a critical piece of equipment that's used in surgery, that can cause direct harm to the patient. So it's very important to always make sure you're doing the correct and proper maintenance in accordance with your hospital guidelines as well as the manufacturer's guidelines. And just a quick couple things I found. So a study of critical incident reports indicated 30% of incidents are related to equipment failure. And this was in the UK, and I found one in the United States where about 5 to 10% of critical incidents are related to equipment as the fault of the incident. So that's important to see that BMEDs do play a critical role in patient safety, and we shouldn't forget that as medical equipment technicians. The next section of what I'm going to talk about is reducing variation. So this is quite important in all aspects of hospital functionality, but by definition, variation is a change or difference in condition, amount, or level. And so the variation in clinical engineering, I broke into three steps, three sections here. So maintenance procedures can increase critical incidents. So if you have a variation in your maintenance procedures, you can increase the risk of critical incidents. For example, if technicians are performing incorrect maintenance procedures based on an old work order data or an old manual, and there's not a certain place to go for every single BMED to kind of verify that they're doing everything the same, so that the correct procedures are being used year after year. And in that way, if they're not, and there's variation in that, they're using old data, it can cause to incorrect maintenance. Maybe they're not checking a new feature or a new software update that needs to be checked now, and that could lead to mishandle or misuse by the operators based on the settings not being verified. Now, variation in data sources can lead to incorrect data validation. So this is like your databases that all the BMEDs build. So if you have unclear or undefined device class and nomenclature validation, it can lead to incorrect reporting and can cause confusion in the procurement process. And this is, for example, if you have your inventory list and you have the same piece of equipment labeled in different ways with an incorrect model designation, and a medical equipment technician is trying to either order parts for that item or actually work on that item, and to find the related materials needed to do both of those processes can be kind of convoluted and just cause a disruption in the process, and that decreases efficiency, and it's really something that can be avoidable by just validating your processes when you're entering a piece of equipment in. Make sure you have the right device class, the right nomenclature, and the right model number. It's something that can be small when you're doing it, but it can result in large kind of hindrances on your efficiency. And the variation in your procurement processes can lead to unnecessary expenditures. This is an example of, so if you're a technician and you're ordering parts for a piece of equipment versus submitting the request to logistics, where they have a special system that they can access to get cheaper parts or something of that nature. And so it's good to have like one set procedure. If you need a part, you need to contact logistics or whatever your procedures might be. It needs to be encompassing to your entire department, so there's no variation, so you can reduce all that excess expenditure and waste of time. And this is really important, and I can't harp on it enough. Just reducing the variation overall is only going to benefit your program. Okay, so let's move on. So the next is the exploration of new technologies and products. And you see I have a computer, a phone, and it's connected to all these different things. And this is in medical equipment world, this seems to be more and more common, that the devices are just growing and becoming more and more connected. And so increased network connected device drives will drive new maintenance technology. So one thing that's interesting that's starting to come up is predictive maintenance. And predictive maintenance utilizes connected devices and the Internet of Things to predict failures before they occur. And this is different from preventative maintenance, where you prevent maintenance either based on a schedule or based on a failure. So this can actually predict the maintenance, which is pretty exciting. So it's important to be aware of this maintenance strategy as new higher technology devices become more commonplace. It's only going to save you money and reduce the time it takes to maintain these devices. So for example, daily maintenance reports can be submitted through the cloud by users and analyzed using software to identify when a device might fail. So you get all these results, and you can see variation in that data that's analyzed by software to say, oh, this component looks like it might go bad in a couple weeks. Order that now. By replacing that small component, you reduce the risk of larger components down the line failing. And having trained BMETs, and it's important, like as this technology comes into play, that having trained BMETs that are trained on these emergent technologies and maintenance strategies on site. I mean, they're gonna help, and it'll reduce your equipment downtime and repair costs if these technologies are utilized properly. And also, the second one I have here is utilizing new products to track two distinctive maintenance strategies. And so it's becoming apparent that the maintenance activities are being divided into old technologies versus new technologies. And this is like the old mechanical stuff that needs like valves replaced and something more mechanical, versus the new technology, which uses software to analyze it, might need an electric component or a board or something that requires a little bit more of looking through data as opposed to just being purely mechanical. And the trend is these higher technology devices might take more time than the older technology devices. So it's important to realize like how much equipment you have that might fit into each category. That way you can determine to get the specialized training that these might take more, the higher technologies might take more time. So to increase efficiency, you need to plan for that and have, okay, these are going to take a little bit more time. Let's put these trained biomeds on this, and then we still have time to do these other older technology maintenance activities as well. And another thing I put on here is utilizing your CMMS to determine the cost of service ratio of the two maintenance strategies. Can provide efficiency for healthcare technology managers to improve efficiency while verifying quality. And all that means is pretty much what I was saying, that if you understand your two maintenance strategies and you can plan for them, it's going to help you save time and money, and also improve the efficiency of how things are getting done. And also, new developing part sourcing software can reduce the cost of maintaining equipment, and that just means access to a database or a service that can find those parts for you cheaper as you need them and faster. So you're not waiting on parts, or you're spending a whole bunch of time researching parts. You have that new technology or that new system that can help you get parts quickly and efficiently. And so there's a lot more to speak on this, but that's all I have right now on the exploration of new technologies and products. So let's move on. And the last one is the access to proper maintenance materials. Sorry. So access to proper maintenance materials. Dedicated policies to ensure proper and current maintenance materials are available to clinical engineering departments improves efficiency. And this is pretty easily understood. If you have the right materials to do the right maintenance, it's gonna improve your efficiency. You're not stuck looking around for the right material or questioning if this is the most current version of this procedure. It's only going to improve efficiency in that way. And also the managers of the BMETs can verify that the proper maintenance is being done, because the BMETs can reference they're using the proper materials. So you know they're doing it exactly in line with the manufacturer's specification or your alternative equipment maintenance cycle. So that's pretty important. And then tracking manufacturer school and purchasing requirements during the life of the equipment. And there's obviously a lot of devices that do require specialized training. And in some cases, you need to go to a specific manufacturer school to get trained on that piece of equipment, to then train others and get the proper materials. So it's important to track those items and also track the technicians that are responsible for either providing the materials or the training or the service on those items. You can save a lot in-house by having a great program where you send your BMETs to this manufacturer school, they come back and they can train your department, and you can bring that maintenance activity back in-house. Also sharing the need of proper manuals from device manufacturers. So just to let manufacturers know that the materials that are required, if they want you to purchase that equipment, that they provide proper service manuals and operator manuals every time. That way, you'll always be ensured that you have the proper materials to maintain anything new that might come into your facility. And it's pretty easily understandable, and I think it's a need, and also just lets device manufacturers know that, hey, we do need these materials because it's our equipment. We want to be able to maintain it in-house. And I know there's a lot going on with that right now, as far as trying to get the proper materials to maintain your equipment. Okay, so let's move on to the importance of oneSOURCE. So utilizing oneSOURCE's variety of database can reduce variation, and this is huge. I really am proud of oneSOURCE for bringing all these products together into one simple source. Like, hospital staff can access manufacturer and in-house documents from one simple source for all their maintenance needs. And not only that, the maintenance manuals that they access there are going to be updated. oneSOURCE contacts the manufacturers directly, so all the materials are coming from the manufacturers and they're updated regularly as well. And this source can be implemented across multiple facilities in a large organization, which is great if you're trying to reduce variation throughout a large organization with multiple smaller satellite facilities and larger hospitals. It can be just a simple source. Now all of your technicians are going to oneSOURCE to get the proper materials, and the materials are verified and updated. So it reduces that variation. You're no longer worried about this site doing a procedure based on a manual that was 10 years old versus another site doing the procedure versus the new manual, or with the new manual. So it's just great that it can be instantly implemented across all your organizations. The oneSOURCE can reduce risk of utilizing outdated maintenance procedures. Just because they're updated, you're always going to make sure you get the correct and updated manual for the device, which is crucial. I know a lot of older like maintenance kind of libraries are just manuals people have uploaded. They're not updated. No one looks at them again once they're there, and they're not named properly. So it's going to help your BMETs and reduce that risk that you might have otherwise. And healthcare technology managers can quickly validate the proper maintenance is performed. So you can, because it's oneSOURCE, you can make sure they can refer to the manual that they used in oneSOURCE, and HTMs can quickly look and see, okay, yeah, they did use this current manual, so I know that the equipment's been checked and verified and calibrated properly. And we're integrating with part sourcing and CMMS software, which provides integrated access to manuals, especially as these products implement new technologies and become more complex to maintain. So that's just, we're integrated with several CMMS programs. So when you're in your CMMS working on a work order, you can quickly navigate within your CMMS to oneSOURCE to find that manual. And you can put that manual right into your model level of your CMMS for that item. which is really useful. And if it's done with an authenticated link, it can automatically be updated every time they go to it. So it's pretty useful, and it's utilized that way right now with several of our clients. And access to proper training manuals and in-house policies can reduce cost and increase efficiencies. This is simply like BMEDs now can access all their manuals right from this one source. They don't need to spend hours trying to find the correct manual or the correct manufacturer. They can just search it up in our system and find it. And now they're able to do more procedures in-house, more validated procedures, so they know what they're using and doing. And it can help provide clarity. If you have a question about, like, well, we've done it this way in the past, let's check the manual, and you know you're going to go to the most current manual where that policy or procedure has changed, quite possibly, and now you know you're doing it correctly. And just once again, technicians can access just from one simple source for all their documentation needs. So this can go across from your operators to your sterile processing technicians to your BMEDs to your facility maintenance people, as well as dental. So, but the biomedical database is really centered around maintenance of equipment. So all the documents in there are gathered in that regard to address the maintenance piece of the BMED world. Okay, and so that's the importance of oneSOURCE, and that's pretty much all I had. I wanted to show a quick product demo of oneSOURCE, just to show everybody. So here is our login screen, and you see right here up at the top, if you're searching through the database and at any time you can't find any documents within the system, you simply select the Submit Document Request button, and this screen will pop up. You select what database you want it to be uploaded to, and you fill out the information and depress Submit button here, and it'll be submitted into our workflow, and it'll be fulfilled. These requests are filled within 3 business days. So it's just a great resource that we don't have absolutely everything, but if we don't have it, just submit a document request and we'll go get it for you. We also have a cloud storage feature, which allows you to kind of upload any documents that don't fit into a biomed category, like an AEM cycle or an in-house preventative maintenance procedure, or even policies. It can submit, or it can support PDF, Excels, and Word documents, and it's completely free form. So that's a great feature that a lot of customers are starting to use. And so here is our database. These are all our different databases. Right now I have Biomedical selected, and I just ran a search of the entire database just so you can see how comprehensive it is. It's got about almost 63,000 individual makes and models of the devices. And just to show you an example, we'll look up life packs here just to see what we offer, because we don't only offer just the service manuals. We also offer end-of-life letters, parts lists, calibration checklists, anything you might need that is essential to maintain the equipment. We'll call and we'll inquire about it and get it. And so here we have a Life Pack 12, and I like to show this one because it's got all document types right in the document. So right here is the end-of-life letter, and we call it discontinued letter. We label everything in accordance with how it's indicated on the manual or document itself. So here's the discontinued letter, and you can go, this also has operating instructions in it. You can go right to the operating instructions based on this bookmark tab. And you can also go to the service manual. And all of our documents will have these bookmarks in the upper right-hand corner. Based on your browser, the bookmark section might be in a different place, but they should be accessible by this, and it's bookmarked right to what you would need to go to. So you can go to calibration, troubleshooting, you can go right to the PIP, the performance inspection procedure for this device. So this is just a small example of the manuals that you'll have access to within oneSOURCE, and we're adding stuff all the time, and this is what the search screen will look like after you perform a search. All these banners here can be clicked on and filtered through. And so the review status, the manufacturer, instrument, catalog number, and model and description are pretty self-explanatory, I think. But the review status, this is if it's current or if it's been revised in the last year. So if a document has changed in the last year, it'll have this mark that says revised. So that's a good way to know if a document's been revised, if you need to kind of look and see if anything's changed. This is the date we've called and reviewed on it, and this is the date that's actually on the document itself. Right here, it just shows you what database it's in. We do have this PM frequency column that shows you, based on what's in the actual manufacturer's literature, what the PM frequency would be for that device. So that's a great tool that a lot of VMETs like. And right here is document type, just shows you the document type. And another great feature about oneSOURCE is you can tag any of these items and add them to favorites to sort of build a database within a database. So you can quickly identify the manuals that you actually need for your facility. So I mean, it's pretty simple to do. You just click on the blue heart and you get a screen here that pops up, and you can add it to existing categories. And I've created all these categories for this account. So you can put it in any of these categories that you want. It's completely freeform, so you can add whatever you want. You could put location Y. And then you can also add an alternative number or alternate name if maybe you refer to this device as something other than what we have. You could just put that in there, and when you search for it, then it'll come up based on that name. And another great feature is you can add a note to any document. So you could put like the procedure is on page 4 through 10. You know, use that for your calibration, or you could even put in a small preventative maintenance or inspection procedure, a homemade inspection procedure here, and it's only visible to your account, but it is visible to everyone who accesses your account. So everyone who has the same username and password will be able to see all your notes, all your favorites. And this is a great tool just to streamline the process. And all you do is you click save, and now it's added to your favorite section. And it's been added by the color of the heart has changed to blue, and you got a little paper icon that shows that you have a note on the device. And if you go up to, if you want to view just your favorites, you just, right here on the top blue bar, you just click favorites, and it's all pretty simple. And now you can see, these are all the items I've uploaded to favorites, and you can filter by category. So Department X. And you can just search docs, and this will just come up with all those. So if you did put a bunch in your mother baby unit or your lab, you can quickly just search based on the category. And this is the only one I put in this category. So that's pretty much the great features. Also, another one is you can look at what's been recently reviewed on this account. So you can, if you've been working on stuff all day and you were just kind of running through, you got called into a procedure and you had to look up a manual on oneSOURCE, but then you had to continue doing your scheduled work at the same time, you can come back here to recently viewed and see all the manuals that you've accessed recently, and you can quickly add those to favorites. Like, oh yeah, that was really useful. I used it to repair this device or identify a fault. So that's pretty useful. And then also the recent revisions tab is another great resource if you want to track those devices and manuals that have been revised recently. And we have weekly revised document lists, so you can check to see. You'll get an email if you submit your email into our system, you'll get an email whenever a document in your favorites list is updated. But if it's not in your favorites list and you just want to check it, or if it is in your favorites list and you got a notification and you want to check the revision status of that, you can search by, we have it broken up into databases. So here's the surgical instrument equipment and dental databases, but what you want the biomedical and facilities maintenance databases. And you can see here, it'll show you when the document was revised, the document name. It'll show you what's been added in the new revision and what was removed from the old revision. So it's pretty useful. You can see if it's just been revised for just branding purposes, so nothing really needs to be adjusted, or if something has changed, if a procedure has changed, we'll indicate it right here, which is extremely useful for the biomed to quickly identify if, before you start a PM procedure, if you need to change or be aware of anything that's changed since last time you did it. And so that is pretty much the entirety of what I wanted to show you as far as oneSOURCE in my presentation. I hope you enjoyed it, and thank you for attending. And
excellent. Thank you so much, Travis. We appreciate the presentation today. And for everyone joining us, we wanted to let you know that this concludes the on-demand webinar. If you enjoyed today's presentation, you might enjoy our other ongoing webinar series, which is Webinar Wednesday. You can find a calendar of upcoming live webinars, as well as an archive of on-demand webinars at the URL webinarwednesday.live. To obtain your certificate for 1 CE credit from the ACI, please remember to click on the link located below this webinar title to complete the survey. If you have any questions, you can reach us at webinars@mdpublishing.com. Thanks so much, everyone.